Hello, my name is Andrea Wirt. I'm a nurse practitioner in the geriatric division of the University of Texas Medical Branch in Galveston. I work with elderly patients and their caregivers. My talk today is on caregiver stress in chronic disease. I'm going to define chronic disease as any disease which is progressive over time, seems to have some ups and downs, but definitely a decline over time, and can, of course, the care of that individual will require be extensive and can cause a lot of stress. And examples would be Alzheimer's disease, heart disease, diabetes, congestive heart failure, Parkinson's disease. Before I get into defining caregiver stress and how to deal with that, I'd like to just give you a visual to remember as we go through this talk. So here I have a bottle of water, and so I'd like you all just to look at this and try to tell me how heavy it is. Don't get too worried about specifics, but just give me an idea. How heavy do you think this bottle of water is? Well, basically, it's a little bit of a trick question. It depends on how long I'm holding it. Right now, it's not that heavy for me to hold, but if you come back and ask me, in the 4 hours of holding this bottle, it will have become quite heavy. Now, if I were to put the bottle down and give my arm a rest, and then a few minutes, pick it up again, I could carry it then a little bit, or hold it then a little bit longer. So remember that visual as we talk about stress today. Caregiver stress can be defined actually by Webster's as a suffering of mind or body, severe physical or mental strain. Actually, Al Seibert in The Survivor Personality identifies that there's no real stress until you feel a strain. And I'm sure all of you identify individuals that you know, family members, friends, who seem to really not have any strain, however you feel that they have a lot of stress. So stress is very subjective. It's unique to each individual, and it's very difficult to define objectively. It's difficult to actually quantify. As I said, individuals deal with stress differently, even present with stress differently. Definitely a difference between men versus women. Men tend to internalize quite a bit, maybe not express when they are under stress. Women might be a little more vocal. Culturally and in between races, we can see some differences as well, and even educational levels of how to deal with stress can be different. We do see, though, that there are some warning signs of stress and strain. These are some that I'm sure all of y'all can identify with, or if not, you're doing quite well with your stress. But here are some. We can see that we have actually a loss of energy, being exhausted much of the time, feeling out of control, feeling tense or nervous, having a lack of interest in the things that you liked to do in the past, becoming isolated, not going out, doing things that you had in the past, having increasing health issues. Actually, studies have shown that caregivers, both former caregivers and current caregivers, have a decrease in their immune system. So we really need to identify if there's an increased health issue going on. Sleep problems, appetite changes, some problems with memory, some irritability. And then these last two that I have listed, the abuse or neglect of the care receiver and even thoughts of suicide can be present if this stress and strain is ongoing and is really not addressed. So as a caregiver, we want to identify when this occurs and take care of it before we get to this point. There is a positive correlation between workload demands and an increased psychological distress. We see studies have shown that caregivers, the more stress that they are under, they have increased anxiety, depression, and fatigue. And as I mentioned, it can even affect their health and decrease their immune system. There are also, we need to identify the source of caregiver stress. First, in order to treat the stress or deal with the stress of how are we going to take care of it, we need to identify what is causing it. So first of all, we want to see if there's too many demands on that caregiver's time, energy, or even money. Time being, does it require a lot of physical time to assist the person, the actual physical energy, strength in order to help someone move from one position to another, get bathed, that sort of thing. And then finances, money involved as far as for equipment, resources, assistance in the home. We also can have stress related to conflicting responsibilities. Responsibilities would be something as in your responsibilities as an employee, with your family members, as a spouse, as your nuclear family if you're caring for a parent. So that can cause a lot of stress. Differing expectations of those individuals. You might feel that your focus needs to be on the person who you're providing stress for, and those individuals believe otherwise. As far as a boss, being there at work routinely and not leaving or being off. And then friends, still being involved in the activities that friends are involved in. Others might not understand how compromised the care receiver is, and that's very stressful, as you would then seem like you must justify as a caregiver why you're providing and how much time you are spending in providing that care. So it can also be identified as a stress. You also, as a caregiver, might feel difficulty in meeting that care receiver's need, both mentally or physically. Mentally would be dealing with possibly the behaviors or maybe the moods involved in having a chronic disease. And then the physical needs, as I mentioned before, if a spouse who's elderly is a caregiver, they have their own limitations in being able to assist physically. That's going to be a stress on them. There's also the pressure of finances or lack of resources that can be quite stressful. Not having enough money to pay for supplies, medications, hiring someone to assist as a caregiver. And then the loss of freedom, especially if your loved one that you're caring for is at home and requires 24-hour supervision or constant assistance. Then you feel trapped in not being able to leave the house. There can be disagreement between family members. Other family members may not feel that you as the caregiver are providing care adequately, or are doing things that they feel are not optimal, and that will be also a stressful situation. And then there could be family members that are not necessarily involved in care. As a caregiver, you feel that they should be involved in the care, and that, again, provides or is a stressful situation. The care receiver themselves might also expect too much of you as the caregiver, and again, there can be that stress between you as the caregiver and the care receiver trying to balance that. Family members can be quite negative as well, or could be, and that would be stressful. Negative in, again, as I mentioned before, not wanting to help or not believing that the care provided is optimal. And then the actual decline that does occur with chronic disease can be very painful to watch over time. And this, again, provides another source of stress. So how do we deal with all of this stress? So we have some coping strategies here. First would be the education of the disease process and the related behaviors. Secondly, joining a support group. Third, to conduct a practical family assessment. And fourth, to develop a plan. And then fifth, to practice positive stress reduction techniques. I'm going to talk about each one of these. Education. As we all know, knowledge is quite powerful and definitely brings a sense of control over especially a situation that can be somewhat unpredictable and not as controlled as you like. So learning about the disease itself, how does it progress, but learning the details of what's involved in that disease, whether it be dementia, congestive heart failure, diabetes, getting that information, of course, you can get that from your provider, but professional organizations, of course, also have the information to educate in terminology that's meaningful to you as a caregiver. So trying to obtain as much education as possible is important. Then again, looking at the disease course, what should you expect in this chronic disease? Most chronic diseases will have ups and downs or exacerbations that would require changes in treatment or ways of doing things. So knowing that, knowing how to identify it, and knowing what to do in those situations reduces stress. It prepares you, and you have then that education of how to deal with it. As I said, the symptoms or the behaviors, knowing those are important. In dementia, for instance, knowing what kind of behaviors, what is the source of them, and then how to deal with them. What do you say when someone keeps repeating themselves or becomes agitated? Or in congestive heart failure, when someone has a sudden increase in shortness of breath, what do you do immediately in that situations? So education is our first thing to try to reduce the stress. Support groups are invaluable. Caregivers tell me all the time how important it is for them to meet with others who are going through the same thing that they are. Having that shared experience, and usually in a support group, you're going to have caregivers who are ahead of you in that progression of the disease, and then those behind you. So it's important to actually interact with both of those individuals. Having someone who actually has shared your experience, has already been through it, and can relate and provide information on how they dealt with it is important, but also as a caregiver, you have experiences that it's important for you to share and to be able to give to others as well. So I encourage you to definitely find a support group, and I'll tell you in a minute where you can go to do that. Some coping strategies for situations and specific behaviors, that's usually what is shared in a support group. The individuals in a support group are talking about how they deal with whatever symptoms, behaviors, or their own feelings of dealing with someone who has a chronic disease that is declining over time. It can be quite educational in a support group, things that maybe as a caregiver you were not aware of, whether it be about the disease process itself, what to do in certain situations, what has worked for others, that you can put in what we call a toolkit to have a lot of different options, because not always are you going to know those options from your provider who provides the health care. It's all these other individuals who tried things that seems to have worked for them and seems to also be helpful. And then they also, in support groups, the individuals there seem to share information about community resources in their area, what programs are out there that have been helpful to them, what for financial programs, but is also as well as care individuals that they could hire to assist them for respite. So it's really important to join a support group. For those individuals who are caring for someone with dementia, the Alzheimer's Association have listed on their website, which is alz.org, their national support groups all over the nation that are available. Parkinson's disease, you can actually go in and write on the web Parkinson's support groups in Texas, for instance, and it will pull up by counties what are out there. Not only will they have support groups for caregivers, but for actually the individuals with Parkinson's disease. So you can do that with the other chronic diseases as well. But I encourage you to find a support group. Again, it's been quite effective for the caregivers that I see. The next part would be to conduct a family assessment. And I use the word family somewhat loosely. We have all sorts of family. We have our immediate ones, extended, and of course our community families. So first to think about what is the description of the patient's or your person's need, and what are their major problems that you're dealing with, that also you're having the most stress with, to identify that. And then identify who are the primary caregivers, and it might only be you, but identify that, but also who are the secondary caregivers. Are these your children, your spouse, cousins, whoever secondary caregivers possibly could be. And they also could be friends and church members. There are quite a few individuals that you have that I'm sure that you would consider some that would be social support. And they just need to be identified and possibly asked. And sometimes that's what I think is somewhat lacking, because we all as caregivers feel that we can handle it. But it's really important to tap into those individuals. Then identifying the community resources. And again, you can those can be identified when you are tapping into some people who are experts in that area, whether it be social workers or, again, those persons in the support group who could to point you in that direction of what community resources are available in your area. And then really look at your financial picture as to where are your finances, what is available to you, and what are you looking at for that duration of this chronic disease. So making that assessment, again, brings some sense of control to a situation where you don't think you have any. When you've written it all down, identified what's available, it becomes a lot less stress. And then with that done, we need to develop a plan. It doesn't have to be a perfect plan, but we want to make it the best of what resources are available. So coming up with who will be these caregivers that will help out. If there's that unknown situation, as you as the primary caregiver, something might happen to you, then who will step in? Who will be available to do the care for your loved one? Once we develop that plan with all this information, we want to set a date to reconvene with the individuals involved and evaluate, do we need to change that, as there have been changes possibly with where we are in the trajectory of this disease. You want to make it always an option to call everyone together to help problem solve when you feel that the plan is not working, and come up with a different plan. Ultimately, on a personal level, you as a caregiver have to deal with yourself and your stress. As I mentioned in the beginning, that stress will take a toll, of course, on you in very negative ways, should we not. So I've talked about how to deal with your loved one's disease, but now as far as things that you can do for yourself, I give one other visual that seems to work, and that's, I'm sure many of you have been on a plane, and they tell you, the steward or stewardess tells you, okay, this oxygen might pop out, and make sure that you apply the oxygen mask to yourself first, and then apply it to your loved one sitting next to you. And that is what I want you to remember, that you have to take care of yourself. If you do not, then you will not be able to adequately take care of your loved one. So remember that. So here are some things that we can do to reduce stress. First is to eat healthy. Healthy being including a lot of fruits and vegetables and water, and making sure you eat on a regular basis, not skipping meals, not foregoing a lot of the healthier choices. Second would be to exercise. Not only do we always promote exercise in our patients in general, we want to definitely use that one as a healthy way to reduce stress. Trying to make it part of your daily routine is usually the most effective. So involve, even if you need to involve your loved one in that exercise, which might be quite effective for them, but make sure that's done on a daily basis. Also getting those regular checkups. I see pretty much on a daily basis caregivers attending to avoid their own checkups, or making sure that they go see their doctor, because they just are too busy providing all that care to their loved one. It's very important that you not miss that. Take a break from the caregiving itself. Make time to actually physically remove yourself from that caregiving. Identify in that assessment someone who could pick up for a period of time so that you can take that break, rejuvenate. get a flu shot. I say that, as I mentioned in the beginning, where that we have that decreased immune system, so we want to protect as much as possible from becoming ill, so ensure that you do get that flu shot. Watch for signs of depression. Some of the signs that I mentioned at the beginning that would be involved, fatigue, problems with sleep, or changes in sleep, changes in appetite. Other signs of depression could be profound sadness, crying, loss of interest in things that you were interested in before. So watch for those signs of depression. Again, if those are noticed, make sure that you are going to your physician or provider in order to take care of that. Staying involved in the hobbies, again, as I mentioned, not foregoing those things that were important to you and that also provided you an outlet for daily stress. So make sure that there is time allowed for you to be able to do that. And then laughter is always important. It's been shown for all sorts of chemical reasons and all sorts in your brain and immune system to be quite helpful. So always remember to laugh, to utilize that as a stress reducer. I end with the Serenity Prayer. I do this talk numerous times a year, and I can tell you all of the caregivers sitting around usually can quote this quickly before I even read it, so they're familiar with it. But it seems to be something that definitely they can relate to, and so I ask you to read along, to grant me the serenity to accept the things I cannot change, the courage to change the things I can, and wisdom to know the difference. Thank you all for attending today, and I hope that this information will be helpful for you in dealing with the stress. Thank you.